Okay, so I do feel a little vindicated with this next story, and I hope maybe you will share some of this with me. There was an article that came out just this week that talked about the correlation between having bariatric surgeries, a variety, the sling, the actual closure, and et cetera, those different procedures that they do for weight loss and caries risk. And trying to make sure that when we're doing these surgeries for patients to help them through their BMI journey, that we are not inadvertently increasing their risk for other problems. Well, interestingly enough, this particular study out of the American Society for Bariatric Metabolic and Bariatric Surgery looked at 100 and some odd patients through a particular period of time to see what their correlation of caries was. So the interesting thing was the patients who had surgery prior to the surgery, they had a rate of 15 carious lesions on tooth surfaces, and that went up to 19.1 after surgery. Interestingly though, the enamel lesions had decreased compared to those who had had the medical treatment. So, for those deeper carious lesions in the dentine, patients had an average pretreatment initial value of 4.3 lesions. 2 years after treatment, that went up to 6.4, while those in medical treatment groups had 4.9. So, the reason I bring this up is because I have seen in my own practice, there are some patients who will go through bariatric surgery and it does appear that the oral environment is a non event. We don't really have an increase in carious lesions. We don't have a decrease. It just sort of is status quo. But I've absolutely had patients that have gone through bariatric surgeries where it is almost a rampant increase in the activity in the oral biome. So I'm happy to see that institutions are starting to look at the connection. You could certainly I think highlight what GERD will factor into this, what the diet looks like when they move them to these liquid protein shakes, how does that factor in to their caries risk. But I absolutely think this needs to be studied because then we're left with the liability to help manage these patients. And quite frankly, if the surgery is a contributory factor towards an increase caries risk, then maybe we should be looking at medical coverage to be able to help these patients get through after post surgery. So I'm at least glad to see that institutions are starting to look at the connectivity between the two and what we can do to help patients before surgery and after surgery, maybe to mitigate the risk of an increased carious lesion environment. It's been a hot topic for the week, but I thought we'd bring it up again. As we've discussed previously, Henry Schein has really been suffering with this cyber attack. You know, we saw this with the ADA, and it took them quite a bit to get back online and get back their data to be able to continue to move forward. And Schein appears to be no different. The particular group that did attack them has identified themselves as the Black Cat ransomware crew. And they have threatened to release a significant amount of data for stockholders and related things with their financial relationships and agreements. And so we're now into week 4 of the cyber attack and no resolution. They are getting workarounds to be able to continue to process orders for clients. In fact, I saw an email from one of our reps locally here who was basically like, thank you and I'm sorry. And it was like, thank you for doing paper orders and I'm sorry you're having to do this. Thank you for putting up with the fact that you can't access your online portal. And I'm sorry you're having to do this. Essentially acknowledging that, we're going back a bit to be able to continue to stay in business. But we're trying to help you as best we can until we get access to our data again. And, I don't know what this looks like. And frankly, scared to death if this ever happens to our company. So, hoping that they can find resolution soon. Last thing I wanted to remind everyone about is Veterans Day is on Friday. There are quite a few events going on across the US where free dental care is being provided to veterans who are not eligible for VA benefits. If you happen to know about a program or are participating in one, kudos to you and what you're doing for our community and for our veterans who desperately need dental help, especially those who don't qualify for VA benefits. If you know about a program and want to post it into the community to drum up volunteering support, please don't hesitate to do so. We would be more than happy to share that information. Any way that we can continue to support our veterans who are, currently serving and post active duty, any way that we can provide dental support to them or just community support, we would be more than happy to do so. And with that, that's the news.